Hello, good morning everyone. It's a great pleasure to be here. As you can hear from my voice, I wasn't entirely sure I was going to make it, in fact, making it an even greater delight to be talking to you today. I am going to talk to you about NHS Direct. My brief is really to think with you about the overall implications of remote and digital services, mostly for patients, but also a little bit for clinicians and for commissioners. So I'm going to begin just by talking a little bit about NHS Direct itself. Some of you may know NHS Direct very well. For those of you who don't, our history began as primarily a telephone service, and we now answer in our core 0845 number about 5 million calls a year from the general public. And we have done some work which shows that we add about £220 million worth of value to the NHS as a whole at a cost of running our core service of about £150 million. And the way that we add value for the NHS in that telephone service is because about half of the people who ring us, we will give them self-care advice that will enable them to look after themselves at home. And if you follow up those people who are given self-care advice by us and ask them what they would have done had they not been able to ring NHS Direct, about half of them would have gone to their GP and about a quarter to A&E. So that's the way in which our core telephone service adds value for the NHS. But over the 10 years that our service has been around, we've developed in a whole range of new directions. And so NHS Direct today does a whole range of different things. And we're constantly developing new services to meet the evolving needs of patients and the public and of our commissioners. So we're now active on the web and on Twitter, and we're seeking to provide a range of innovative multi-channel services to improve the experience of our patients and to help the NHS meet the challenges of providing health services in today's environment. I mean, David talked about a few minutes ago about we have a new kind of government. I think we need a new kind of NHS. And I'm going to talk about eHealth, but I'm not primarily going to talk about this sort of eHealth. This is a very, very nice diagram, which is one way of thinking about eHealth. This is about sophisticated high-tech instruments, things like the remote diagnostic services, mobile wireless sensors sending information to central points to enable 24-hour sophisticated biometrical monitoring. That's not what I'm going to be talking about today. I'm going to be talking about what it means to use eHealth with readily available technologies, with the kind of technologies that are already woven into the fabric of our daily lives. I'm talking about mobile phones, I'm talking about email, I'm talking about text, I'm talking about the web. And we know today that 70% of UK households are on the web, and that even more broadly than that, mobile phone technology is more or less ubiquitous. More or less everyone has a mobile phone these days. You're more likely to retain your mobile phone number than you are to retain your address, for example. And there's a significant proportion of the population who organise their entire lives on their mobiles, particularly the young. We know that amongst adults, about half of people are very comfortable using a range of technologies. They switch easily from the internet to the web, to digital television, to text, and they're using all of those technologies to research, to communicate, and to transact. And as any of you with teenagers will know, teenagers can do all of those things simultaneously, as well as talking on instant messaging about how utterly unreasonable their parents are. So I'm going to be talking about how we can use those sorts of technologies to radically improve patient experience of using the NHS and to radically drive down cost. And we know that these kinds of technologies have the ability to empower patients, to enable them to access expertise and support so that they can look after themselves more at home, and so that by taking control of their own health, they can be empowered to make better informed choices about their health. And through the use of these technologies, what we can do is we can release and we can safeguard the NHS's precious face-to-face and physical resources for the people who really want and need them. I think when we talk about these sorts of visions for the NHS, I often find it helpful to use banking as an analogy. When I first had a bank account and started using the banking system, although it was my money, to do almost anything with it, I had to go to a bank within relatively restricted opening hours, a bank that was run by a gentleman who looked rather like that one on the right. And heaven forfend, if I wanted to borrow money, they certainly had to look at the whites of my eyes and interrogate me face to face. I'm glad to say that my bank now looks much more like this. I think what's important about this is not only is it a great deal friendlier and more egalitarian, actually, than my bank used to be, but what's also most significant about it is the very many things that I can now do for myself with my own money in the channels that suit me and in at the time of the day or night that I want to. Because in the olden days, although I was technically the customer and it was my money, I always felt that it was the bank that was making the decisions and it was the bank that was in control. And now I feel that I'm in control and I can do the things that I want to do. And you won't be able to read that, but it's all the sorts of things that we're all very familiar with. Half of adults in the UK have online bank accounts, and you can move your money and you can pay bills and you can borrow money and you can save and you can compare a whole range of products online today from your home and increasingly from mobile devices too. I'm not going to argue that it's only the private sector that does these things. In fact, there are very good examples where the public sector is using technology in very creative ways to save public money and to improve the experience of citizens. This is my local authority. Again, you won't be able to read this, but what that offers me is the ability to do a whole range of really useful things online. So, for example, I can pay a parking fine, not that I've ever had parking fines, you can imagine. That's because I bought my parking permit online. I can put in a planning application, I can renew a library book, I can report a problem in my street. So there's a whole range of very practical, valuable things that I can now do online, and meanwhile my council is saving money by reducing the amount of clerical resource that's needed behind the scenes to process these routine transactions. In contrast, if you look at my GP surgery, I'm lucky I have an excellent primary care practice. The professionals are very good, the care is of a very high quality. But if I go to the website, it reminds me of the kinds of websites that most businesses had maybe 10 or 15 years ago. It's a flat shop window. You can't do anything useful with it at all. It has no functionality whatsoever. So I can't use this website to book an appointment, to get a repeat prescription, to get test results, or even to email the practice. It's useless. And it has pages and pages that look like this. And I think, like me, you'll probably feel that's a bit of a throwback. And what I think is significant is the opportunities that we have to do better than that for patients and for the NHS. So very quickly, I'm going to run through some of the areas of opportunity that we can see today with these readily available technologies, and some of which are being done by NHS Direct. So beginning with urgent care, NHS Direct now offers a range of symptom checkers. You probably heard recently there was quite a vociferous self-care campaign that I think was telling us that 15% of GP appointments were for things that people could really look after themselves. This is one of the ways to help people have that information, understand what's wrong with them and make good decisions without having to use a health professional. So we have a range of symptom checkers. This one is the mental health one. By taking yourself through a personalised, interactive symptom checker, you can then book a telephone call where somebody from NHS Direct, a nurse from NHS Direct, will ring you back, or you can follow that through into an anonymous private web chat.